Welcome to the Deep Dive. Today, we're going deep into some exciting new research in ophthalmology,
Yeah.
curated from international journals by the one and only Professor Dr. Suhail Sarwar.
That's right.
Now, just so everyone's clear, this deep dive is really for our fellow healthcare professionals.
Yeah.
If you're looking for more general info on common eye conditions, you can always check out Professor Sarwar's public podcast series.
Good point.
But for today, we'll be focusing on some really cool findings about allergic conjunctivitis,
Yeah.
dry eye disease, and even keratoconus.
Mm,
And we're going to be zeroing in on the practical stuff,
that's right.
the stuff that you can actually use in your practice.
Exactly. We're going to be getting into some serious immunology here
Yeah.
with very specific takeaways for clinicians.
Perfect. Okay, so the first study that really caught my eye, no pun intended,
Uh-huh.
is this one by Kishimoto et al. From 2022.
Interesting.
They basically asked,
Yeah.
how does pre-existing dry eye disease affect the severity of allergic conjunctivitis? To figure that out, they worked with mice,
Mm.
surgically removing their tear glands to simulate aqueous-deficient dry eye.
Okay.
Then they exposed these mice, along with a control group, to allergens.
Interesting.
And the results were pretty striking.
Yeah.
The mice with the dry eye,
Uh-huh.
they experienced much worse eyelid edema, conjunctival redness,
Oh, wow.
and vascular permeability compared to those with normal tear production.
That's significant.
Yeah, that's tough for those mice and maybe for our patients too.
Right.
What's the deal here? Why would dry eye make allergic conjunctivitis worse?
Well, the researchers think that tear deficiency, it might actually increase the time that allergens are in contact with the eye surface.
I see.
That prolonged exposure could lead to a bigger immune response,
Okay.
which could explain those more severe symptoms.
That makes sense.
Yeah.
So what does this mean for us in the clinic?
Well, I think it tells us
Yeah.
that we need to be way more aware of dry eye potentially making allergic conjunctivitis worse in our patients. We might even need to rethink how we manage these conditions.
Okay.
Maybe by thinking about proactive dry eye management,
Right.
even in patients who mostly have allergic conjunctivitis.
Interesting. So it's not just about treating what's right in front of us, but
Mm.
thinking about the bigger picture
Yeah,
and how these conditions can kind of work together.
exactly. And speaking of being proactive,
Yes.
there are 2 more studies that looked at different ways to use antihistamine eye drops for seasonal allergic conjunctivitis.
Okay, this is where it gets really interesting.
Yeah.
One study by Fukushima et al., also from 2022, took a really interesting approach.
Okay.
They compared proactive use of antihistamines,
Mm.
meaning regular use even without symptoms,
Uh-huh.
to as-needed use,
Okay.
where patients only use the drops when their eyes are bothering them.
Got it.
And get this,
Yeah.
the patients using the drops proactively had significantly better quality of life after just 2 weeks.
Wow, that's impressive.
Fewer allergy symptoms leading to better overall well-being.
Right.
Who wouldn't want that?
I know, all right.
But here's the catch.
Yeah.
Another study by Kodama et al.
Hmm.
In 2023 surveyed seasonal allergic conjunctivitis patients
Mm.
and found that only a tiny fraction,
Really?
something like 4 or 5%,
Wow.
actually followed a proactive regimen.
So most people just wait for the symptoms.
Yeah, it seems most people wait for the symptoms to hit before even thinking about the drop.
It's like we always want that immediate relief
Yeah.
instead of taking the long view.
Right. It's human nature.
It is.
But this really highlights something important for us as clinicians.
I agree.
We need to educate our patients about the benefits of being proactive.
Yeah.
Explain that using antihistamines consistently,
Right.
even before symptoms start,
Uh-huh.
can really help them control their allergies and have a more enjoyable allergy season.
Absolutely. We need to help them shift their mindset.
I love that.
Yeah.
Shifting from reactive to proactive.
It's just powerful.
That's a powerful message,
It is.
not just for allergies,
Mm.
but for life in general.
Right.
But getting back to the research,
Yeah.
it's fascinating that Fukushima et al. Also found something else in their 2022 study.
Okay.
They found that proactive antihistamine use
Uh-huh.
wasn't just helping with physical symptoms like itchy eyes,
Interesting.
but it was also linked to better mental health.
Oh, that's important.
Yeah.
They saw less frustration,
Uh-huh.
less unhappiness,
Wow.
and even better sleep quality.
Hmm.
It seems like consistent symptom control can have these positive ripple effects that go beyond just feeling physically better.
So when we're talking to patients about treatment options,
Yeah.
we should really highlight that proactive antihistamine use could have these broader benefits.
Definitely.
It's not just about stopping the itch.
Mm.
It's about feeling better overall.
Exactly. It really shows how connected physical and mental health are,
Yeah.
especially with chronic conditions like allergic conjunctivitis.
And speaking of connections, let's talk about another important group, contact lens wearers.
Right.
A 2024 study by Fujio et al.
Okay.
Published research on antihistamine-releasing contact lenses.
Interesting.
But here's the thing.
Yeah.
They specifically excluded contact lens wearers from their study.
Oh, wow. That's really interesting.
Yeah, and it highlights a big challenge in managing allergic conjunctivitis
Oh, I see.
contact lens wearers.
Right.
The fact that they excluded contact lens wearers shows just how complex it can be to treat this population.
Yeah. It makes sense when you think about it.
Yeah.
Contact lenses can trap allergens.
Huh?
They disrupt the tear film.
Right.
And they can irritate the eye surface.
Exactly.
All of which can make allergic conjunctivitis worse.
And there's research to back that up.
Yeah.
A study by Arita et al. Back in 2012 found that contact lens-related allergic conjunctivitis is associated with changes in the shape of the meibomian glands.
So it's not as simple as just prescribing antihistamine drops.
No, it's not.
We need to be really careful when we're evaluating and monitoring contact lens wearers
Right.
who have allergic conjunctivitis.
Absolutely. Now let's talk about environmental triggers and allergic conjunctivitis.
Okay, let's get into those external factors.
Yeah, we know they play a big role.
They do.
But what are the latest findings telling us?
Well, 2 studies published in 2024,
Okay.
one by Mimura et al.
Huh?
And another by Liu et al. Both looked at the connection between air pollution and allergic conjunctivitis.
Interesting.
Mimura et al. Found a direct correlation between levels of suspended particulate matter,
Okay.
or SPM in the air, that's pollution,
Right.
and an increase in outpatient visits for allergic conjunctivitis.
Hmm.
And this correlation was especially strong in the winter.
That's interesting.
Right.
You wouldn't think of winter as allergy season,
It wouldn't.
but their data clearly shows a link.
Yeah. It challenges what we think we know.
It does.
And Lua found a similar connection, this time between PM10 and NO2 pollution
Okay.
and allergic conjunctivitis.
Hmm.
What's really interesting is they found delayed effects,
Oh, wow.
meaning that exposure to pollution could cause symptoms days later.
That's concerning.
It is.
It makes you wonder about the long-term effects of air quality on our eyes.
Yeah, and it means we need to be asking patients about their environment,
Right.
even if it doesn't seem related to their current symptoms.
I agree. It really shows the importance of educating patients about potential triggers.
Especially those in areas with lots of pollution.
Now let's get microscopic.
Okay.
Dive into the immune system.
I'm ready.
What's the latest on the mechanisms behind allergic conjunctivitis?
Well, there's a fascinating study by Gies et al. From 2023. They compared tear fluid protein profiles
Interesting.
in patients with keratoconus, or KC,
Uh-huh.
allergic conjunctivitis,
Okay.
and those with both.
So they were looking for clues in the tears,
Yeah.
like a detective.
Right.
What they find.
Well, they found unique protein signatures
Okay.
associated with each condition.
Yeah.
This tells us that different things are going on at the molecular level.
So different processes are driving these conditions. That's an important distinction.
It is.
It suggests that one treatment might not work for everyone,
Right.
and that we might need to tailor treatments based on what's happening underneath.
Exactly. And there's more Tajbaksh et al. In 2023, used in vivo confocal microscopy
Okay.
to look at dendritic cells in the conjunctiva.
So they were looking at the types of immune cells
Yeah.
and where they are.
Right. What did they see?
Well, I found that dendritic cells were more abundant and looked different
Okay.
in the allergic conditions.
Interesting.
This suggests they might be driving the immune response in allergic conjunctivitis.
That opens up the possibility of targeting these cells with new therapies.
That's fascinating.
It is.
It's like we're figuring out the immune system
Yeah,
and how it contributes to allergic conjunctivitis.
absolutely. And one more study on the immune response I think is worth mentioning. It's by Kimura et al. From 2023. They looked at a pathway in conjunctiva called goblet cell associated passage, or GCASE,
Okay.
which is basically how allergens get into the eye quickly.
Got it.
They found that allergens get in super fast.
Wow, so the body reacts almost immediately.
It does.
It's like trying to stop a runaway train.
Yeah,
This really shows the need for treatments that can act fast.
to block that cascade.
Yes, exactly.
Okay.
Speaking of new treatments,
Okay.
let's move on to some research exploring new therapies and potential future directions for allergic conjunctivitis treatment.
Let's dive into the cutting edge. What are researchers cooking up?
Well, it all. In their 2023 study, explore the use of human umbilical cord mesenchymal stem cells,
Okay.
or HUC-MSCs.
Wow, that's a mouthful.
I know, right?
Yeah.
They injected these stem cells under the conjunctiva in mice with allergic conjunctivitis.
So they're delivering those stem cells right to the inflammation. Interesting.
And they saw some promising results.
Okay.
They found a reduction in inflammation and a rebalancing of the immune cells involved in the allergic response.
That's remarkable stem cell therapy for allergic conjunctivitis.
Yeah, who would have thought?
It's like science fiction.
It really is. It's a testament to how innovative researchers are.
Yeah, they're really dedicated to improving patient care.
And there's another exciting development. Nagata et al. In 2023 investigated the effects of a special lipid molecule called 5,6-diheat.
Interesting. What is that and what did they find?
It's a type of lipid mediator
Okay.
which helps regulate inflammation.
I see.
Think of it as a peacekeeper in the immune system,
Got it.
helping to calm things down when they get out of control.
Interesting.
They found that 5,6-diheat effectively reduced a bunch of allergic conjunctivitis symptoms,
Yeah.
suggesting it could be a new treatment option.
So it's like a natural anti-inflammatory.
Yeah, pretty much.
Yeah.
That's really exciting.
It is.
It could be huge for patients who don't respond to traditional therapies
Right.
or want a more natural approach.
Exactly.
But I imagine it'll be a while before we see these treatments in the clinic.
Yeah, more research is definitely needed.
Right, but it's definitely promising.
It is. Now let's not forget about antihistamines.
Oh yeah, good old antihistamines.
They're still really important for managing allergies.
They are.
But a 2024 review by Suarez-Cortez et al. Looked at the safety and tolerability of different antihistamine eye drops
Okay.
and raised a really important point.
What's that?
We need more research on the long-term effects of these drops on the ocular surface,
Makes sense.
especially since allergic conjunctivitis and dry eye often happen together.
That's a great point. It reminds us that even with well-established treatments,
Yeah.
there's always more to learn.
Always.
And it shows how important it is to consider the whole patient,
Absolutely.
not just their individual symptom.
Right. And speaking of potential long-term effects,
Yeah.
another study from 2024 by Leonardi et al. Highlighted how important it is to use preservative-free eye drops
Okay.
whenever possible.
Interesting.
They pointed out that preservatives, like BA,
Yeah.
can actually damage the ocular surface,
Oh, wow.
which is especially bad for patients with allergic conjunctivitis.
Right, because their eyes are already more sensitive.
Exactly. That's such a small but crucial detail that could really make a difference for our patients.
Preservative-free options.
Yeah.
Something to keep in mind when we're deciding on treatments.
Absolutely. Now, before we move on,
Okay.
I want to mention another study that looks at something we often forget about in allergic conjunctivitis management.
What's that?
It's by Juan Abdul Halim et al. From 2024. And they looked at corneal biomechanics.
Corneal biomechanics.
Yeah, basically the strength and stability of the cornea
Got it.
in patients with allergic conjunctivitis.
Okay.
And they found that chronic eye rubbing,
Right.
which is common in allergic conjunctivitis, can actually weaken the cornea over time.
Wow. So all that rubbing can change the structure of the eye.
It can.
That's scary. I bet most patients don't know that.
Probably not. It really shows how important it is to address not just the symptoms, but also things like eye rubbing
Right.
that can cause problems down the line.
So it's about taking a holistic approach,
Exactly.
thinking about both the present and the future health of the eyes.
Exactly. And it also shows how valuable it can be
Yeah.
to monitor corneal biomechanics in these patients,
Okay.
especially those who rub their eyes a lot. We can use tools like the Ocular Response Analyzer and the Corvus ST
Right.
to actually measure corneal strength and find patients who might be at higher risk.
It's really interesting.
It is.
It's amazing how all these different studies are actually connected.
They are. It's like solving a puzzle.
Yeah.
Each study gives us a piece,
Right.
and as we put them together, we start to see the big picture.
It's amazing.
Yeah.
And the research is always evolving.
Always.
So I'm sure there will be even more pieces to add in the future.
Oh, absolutely.
Oh, I can't wait to see what the future holds.
Me neither.
But for now,
Yeah.
let's take a short break and gather our thoughts.
Sounds good.
We'll be back in the next segment to continue our deep dive into the latest advancements in ocular allergy research.
Looking forward to it. Welcome back to our deep dive into the frontiers of ocular allergy research. Let's pick up where we left off, exploring the latest advancements in treating and understanding allergic conjunctivitis.
You know, I'm still thinking about that dexamethasone intracanalicular insert we talked about. Kenyon et al. Found it to be really effective in their phase 3 trial.
It was a well-designed study.
But I'm curious, how does it compare to traditional topical corticosteroids?
That's a great question. The insert has a few key advantages.
Okay.
First, it provides a sustained release of medication. So patients don't have to remember to use drops all the time.
That's a big plus for sure.
Right. It can be hard for some people to stick to a strict drop schedule.
Yeah, compliance is always a challenge.
Exactly. And there's another advantage.
What's that?
Because the drug goes directly into the tear ducts.
Okay.
It could reduce the risk of those systemic side effects you sometimes see with long-term topical corticosteroids.
So more targeted delivery and potentially fewer downsides.
Exactly.
That's a win-win.
I agree. It's great to see these kinds of innovations that can really make a difference for our patients.
It's exciting stuff. Now, switching gears a bit,
Okay.
I'm really intrigued by all this new research on the immune mechanisms behind allergic conjunctivitis.
Yeah, it's a hot area of research.
We talked about the Gies et al. Study that found those unique protein signatures in tears.
Right.
And the Taj-Baksh et al. Study
Yeah.
that showed those interesting differences in dendritic cells. I know this is getting pretty deep into the science.
It is.
But what does it all mean for future treatments?
Well, I think this research is laying the groundwork for more targeted therapies.
Okay.
By understanding exactly how inflammation and immune cells work in allergic conjunctivitis, we can develop treatments that address the root cause
I see.
instead of just masking the symptoms.
So we're going beyond symptom relief
Exactly.
and aiming for a more precise and personalized approach.
Exactly. Imagine tailoring treatments
Yeah.
based on a patient's unique immune system or tear film.
Wow, that would be amazing.
It would. It's like personalized medicine for the eyes.
Are there any other promising areas of research along those lines?
Absolutely. The research on stem cell therapy
Right.
and those targeted anti-inflammatory agents is really pushing the boundaries.
It's a fascinating time to be in this field.
It really is. Now, going back to antihistamines, we talked about using them proactively.
Right.
But what about different types of antihistamines?
Good question.
Is there any research comparing how well they work?
That's what I was thinking.
Well, there's a 2023 meta-analysis by Lojaya et al.
Okay.
That compared olopatadine with ketotifen for allergic conjunctivitis.
Interesting.
They looked at data from several randomized controlled trials and found that olopatadine might be a bit better at reducing redness, but there wasn't much difference in terms of itching, tearing, or other symptoms.
So even though there might be small differences between specific antihistamines,
Yeah.
the main takeaway is that they're all useful for managing allergic conjunctivitis.
Exactly. And like we said before,
Yeah,
it's always best to choose preservative-free formulations.
Right, to protect the ocular surface.
Exactly. Speaking of the ocular surface, we talked about the meibomian glands earlier.
Right, Urita et al.
Yeah.
Found that contact lens-related allergic conjunctivitis could affect these glands.
They did?
Has there been any more recent research on that?
You're good. There's a really interesting study by Wei et al. From 2024 that took a closer look at meibomian gland changes in allergic conjunctivitis. What's really cool is they used artificial intelligence to analyze images of the glands.
AI for meibomian glands. That's wild. What kind of information can these algorithms get?
Well, they can measure all sorts of things.
Okay.
Like gland length width area and even something called the gland deformation coefficient.
Wow. It's like giving a computer supervision
Yeah, exactly.
to see these tiny structures in detail.
So what did they find? Were there any differences in the meibomian glands of patients with allergic conjunctivitis?
They found that patients with allergic conjunctivitis tended to have shorter, narrower meibomian glands
Interesting.
compared to those without allergies. They also saw more glands that weren't working properly.
So allergic conjunctivitis could actually be harming these glands.
It seems that way. And it highlights another potential link between allergic conjunctivitis and dry eye disease.
Right. Remember those meibomian glands?
Yeah.
They produce the oil layer of the tear film,
Right.
which helps to keep the tears from drying out too quickly. If those glands aren't working right, it can contribute to dry eye.
It's all connected.
It is.
It's like a vicious cycle.
Right.
Allergic conjunctivitis can lead to changes in the meibomian glands, which can make dry eye worse,
Yeah.
which can then make the allergic conjunctivitis even worse.
Exactly. It all comes back to that comprehensive approach
Yeah.
to managing both allergic conjunctivitis and dry eye.
This makes me wonder,
Yeah.
could things like air pollution
Mhm.
also affect meibomian gland health?
That's a great question. We already know that air pollution can trigger and worsen allergic conjunctivitis,
Right.
so it wouldn't be surprising if it also affected the meibomian glands.
It would be interesting to see some research on that.
I agree. Now, before we move on to some of the more groundbreaking stuff,
Okay.
I want to touch on something we mentioned earlier,
Mhm.
the mental health impact of allergic conjunctivitis.
Yeah, Fukushima et al. Found that proactive antihistamine use could improve mental well-being. But can allergic conjunctivitis itself, independent of treatment,
Okay.
affect mental health?
There's definitely a connection. It's
Yeah.
just often overlooked,
That's-
all that itching, redness, tearing, and discomfort.
Yeah.
It can be really frustrating and disrupt daily
It
life.
can affect sleep, work, social activity,
Exactly.
even just enjoying being outside.
Right. It's easy to see how it could affect someone's mental health.
Yeah. And studies have shown that people with allergic conjunctivitis
Oh,
often have higher levels of stress, anxiety, and even depression.
that makes sense. When you're constantly dealing with these symptoms,
Yeah.
it's going to affect your mood and how you feel overall.
So how do we address this in our practice?
It's really important for us as clinicians to
Yeah.
be aware of this connection
Mm.
and to talk to our patients about any mental health concerns they might have.
Okay.
It's not just about treating the physical symptoms, it's
Really?
about understanding how allergic conjunctivitis affects the whole person.
Absolutely. It's about holistic patient care.
Exactly. And this might mean working with other healthcare professionals,
Ah.
like allergists and mental health professionals, to make sure our patients are getting the best possible care.
It's about building a support system
Yeah,
that addresses all aspects of the patient's experience.
exactly. Now let's talk about some of the more groundbreaking research in allergic conjunctivitis.
Well, okay. And I'm always excited to hear about the cutting edge stuff.
Well, get ready to be amazed. Researchers are exploring some really innovative treatments.
Huh?
One area that's really exciting is the use of lipid mediators like resolvins.
Resolvins. What are those?
Resolvins are molecules that occur naturally,
Okay.
and they're really important for resolving inflammation and helping tissues heal.
So they're like the body's own anti-inflammatories.
Exactly. And the idea is to use these natural molecules to treat allergic conjunctivitis.
Interesting. Are there any studies that support this?
Yes, there are. Studies have shown that resolvins can actually reduce allergic conjunctivitis symptoms in animals. Okay. One study that I found really interesting was by Nagata et al. In 2023. They looked at the effects of a specific resolvin called I6-DI8 in mice with allergic conjunctivitis.
And what did they find? Did it work?
They found that 5,6-DI8 significantly reduced a bunch of symptoms
Right.
like eyelid swelling, redness, and tearing.
Mm-hmm.
It was even as effective as dexamethasone, which is a really strong corticosteroid.
So these resolvins could potentially be a safer, more natural alternative to traditional anti-inflammatories.
That's what we're hoping for. And it's not just resolvins. Researchers are also looking at other lipid mediators
Okay.
like protectins and maricins
Interesting.
for their potential benefits in treating allergic conjunctivitis.
It's really exciting to see this shift
I agree.
towards using the body's own healing mechanisms
Right.
to treat disease.
It feels like a much more holistic and sustainable approach.
It does. Instead of suppressing the immune response,
Yeah.
we're finding ways to guide it towards resolution and healing.
It's like teaching the body how to heal itself.
Exactly. It's a beautiful concept.
It is.
But how are these findings being used to create real treatments for patients?
That's a great question. And it's important to remember that research takes time to translate into practice.
Right. Of course.
But we are starting to see some promising developments.
Yeah, okay. Like what?
Well, for example, there are now eye drops with hyaluronic acid,
Mm.
which is a natural substance that lubricates and protects the eyes.
Okay.
Hyaluronic acid can help with dry eye symptoms,
Right.
which we know can make allergic conjunctivitis worse.
So it's a double benefit.
Exactly. Are there any other examples of how this research is making its way into the clinic?
I'm curious.
Absolutely. Researchers are also developing new drug delivery systems
Okay.
that can better target medications to the eye.
Interesting.
This includes things like nanoparticles and liposomes,
Yeah.
which can basically encapsulate drugs
Mm.
and help them get into the eye tissues better.
So we're talking about treatments that are more targeted and potentially last longer.
Exactly. And like we talked about earlier,
Yeah.
the development of that dexamethasone intracanalicular insert
Right.
is a great example of innovation in drug delivery.
It is.
It gives sustained release of the medication. So patients don't need to use drops as often,
Right.
and it could reduce side effects.
It's amazing to see how much these advances are helping patients.
It really is. But let's not forget about lifestyle changes.
Oh, yeah. Good point.
They can make a big difference in managing allergic conjunctivitis.
What are some of the key things patients can do? What advice do you usually give?
One of the most important things is to figure out what triggers their allergies and then avoid those things.
Right.
This might mean keeping windows closed when pollen counts are high, using air purifiers to get rid of allergens inside, and washing bedding often to reduce dust mites.
So it's about being proactive and controlling their environment.
Exactly. And good eye hygiene is also important. Okay.
That means washing hands often, not touching the eyes,
Right.
and taking out contact lenses before bed.
Good advice. Those are simple things that can really help.
They can.
Yeah.
What about patients who also have dry eye? Any specific recommendations for them?
That's a good question. What do you suggest?
For dry eye, using artificial tears regularly can really help.
Yeah.
It's like giving the eyes a drink of water.
I like that analogy. Any other tips for managing those symptoms? What about eye rubbing?
Eye rubbing is a tough one. I know it's hard to resist,
It is.
but for those who just can't help it,
Yeah.
cold compresses can feel really good and help reduce inflammation.
So it's a combination of things.
Yeah.
Avoiding triggers, good hygiene, and finding healthy ways to manage symptoms.
Exactly.
Yeah.
And when you combine lifestyle changes with the right medical treatment,
Right.
patients can see a real improvement in their allergic conjunctivitis.
It's a team effort between the patient and the doctor,
Absolutely.
working together to get the best results. I'm really impressed with all the research being done in this area.
Me too. It shows how dedicated researchers and clinicians are
They are.
to finding better ways to diagnose, treat, and prevent allergic conjunctivitis.
It's a testament to how much this condition affects people's lives.
It is. Millions of people around the world deal with allergic conjunctivitis.
Exactly.
So finding effective solutions is really important.
It is. It's inspiring to see this level of commitment to better patient care.
It really is.
Oh.
It gives me hope for the future of allergic conjunctivitis management.
Me too.
Yeah.
And it's a good reminder that scientific discovery never stops. There's
Yeah.
always something new to learn.
Speaking of exploring new things,
Yeah.
we've covered a lot today.
We have.
But there's one more area of research I want to talk about before we wrap up this segment.
Okay, I'm listening. What else do you have for us?
It's something that's been kind of hinted at throughout our conversation, and it has to do with the gut microbiome.
The gut microbiome. That's interesting. I know there's a lot of research on the gut microbiome and its role in overall health.
Right.
But how does it connect to allergic conjunctivitis?
Well, it might seem far-fetched,
Yeah.
but there's more and more evidence that the gut microbiome plays a part in regulating the immune system and controlling inflammation throughout the body,
I see.
including the eyes.
The gut microbiome is a complex system.
It is.
And we're just starting to understand all the ways it affects our health.
Exactly.
Yeah.
But what have researchers found specifically about the gut microbiome and allergic conjunctivitis?
That's what I'm curious about.
Well, the research is still new,
Okay.
but there are some interesting clues.
Like what?
For example, studies have shown that people with allergic conjunctivitis often have an imbalance in their gut microbiome,
Interesting.
with too much of certain bacteria and not enough of others.
So it's similar to what we see in other allergies like eczema and asthma.
Exactly. And there's also some evidence that probiotics, which are those live bacteria that can help rebalance the gut microbiome, might actually help with allergic conjunctivitis symptoms.
So could we actually influence the immune response in the eyes by changing the gut microbiome?
That's the idea.
Yeah.
It's a really exciting area of research because it opens up new possibilities for preventing and treating allergic conjunctivitis
Interesting.
by targeting the gut.
It's a holistic approach
It is.
that recognizes how different systems in the body are all connected.
I love that. It's a whole body approach to eye health.
Exactly. Now, it's important to note
Yeah.
that this research is still pretty early,
Uh-huh.
and we need more studies to be sure about these findings,
Of course.
but it's definitely an area to keep an eye on.
I agree. It could completely change how we think about and manage allergic conjunctivitis.
It could be a game changer.
It really could. And it shows how scientific discovery is always pushing the boundaries
Always pushing the boundary.
of what we know.
Absolutely. There's always more to learn.
Well, my head is spinning with all this new information.
Mine too. It's been a great discussion.
It has. We've covered so much ground today.
We have.
And it's clear that the future of allergic conjunctivitis management is bright.
I agree. It's a really exciting time to be in this field.
It is. But I think we've earned a short break.
Sounds good.
We'll be back in the next segment to wrap up our deep dive into the latest advancements in ocular allergy research.
Looking forward to it. Welcome back to the deep dive. We've been through a ton of research on ocular allergies.
It has been a lot.
And now it's time to put it all together.
Yeah, and look ahead.
Exactly.
It's been quite a journey.
It has.
From dry eye and allergic conjunctivitis to stem cell therapy and even the gut microbiome.
It's all connected.
It feels like we've covered everything.
We've explored a lot, for sure, and I think a few key themes have come up.
Okay, like what?
Well, I think the biggest one is this move towards personalized treatment for allergic conjunctivitis.
You're right. It's not one size fits all anymore.
Exactly.
We're recognizing that everyone experiences allergic conjunctivitis differently.
Exactly. We wouldn't expect everyone to wear the same size clothes.
Right.
So why would we expect everyone to respond to the same treatment?
Good point. This personalized approach is really being driven by better diagnostics.
It is.
Things like tear film analysis and immune profiling.
Right.
And also the development of those targeted therapies.
Exactly. So instead of just treating the symptoms,
Yeah.
we're trying to treat the individual.
Right.
Taking into account their specific needs and what's actually causing their allergic reaction.
And it's not just about the eyes anymore either.
Right. We're realizing that allergic conjunctivitis is often part of a bigger picture.
Exactly. The research connecting it to dry eye, asthma, even the gut microbiome.
It's fascinating.
It's like a reminder that our bodies are these complex systems.
They are.
And it's all connected.
Everything's connected. What happens in one part of the body can affect other parts.
And this way of thinking, this holistic perspective,
It's crucial.
it's really important for developing those comprehensive treatment strategies.
Absolutely.
It's not just about the symptoms in the eyes.
Right. We need to think about lifestyle changes, environmental controls, even therapies that target the gut microbiome.
It's a multifaceted approach.
It is.
Addressing all of the different factors to really help our patients.
Exactly. And that brings us to another important point.
Okay.
The impact of allergic conjunctivitis on quality of life.
Yeah, we've talked about the physical and mental health burdens.
We have.
But what about the economic burden?
That's a great point. Allergic conjunctivitis can get expensive.
It can, especially for patients with chronic or severe cases.
Exactly. Think about all the costs, doctor's visits, medications, lost productivity, and even just the impact on quality of life.
It all adds up.
Yeah.
And that's where being proactive and taking preventative measures is so important.
Absolutely. By managing allergic conjunctivitis effectively, or even preventing it, we can potentially lower the overall cost.
It's an investment in long-term health and well-being.
It is for both the individual and society.
I like that. Okay, so let's talk about some of the specific advancements that are shaping the future of how we manage ocular allergies.
Okay, sounds good.
What are you most excited about?
Well, one area I'm really excited about is the development of biologics.
Biologics?
Yeah, these are medications made from living organisms, and they're designed to target very specific molecules involved in the allergic response.
It's like precision medicine.
Exactly. And we already have some biologics for severe allergic asthma and eczema.
Okay.
And researchers are now looking at how they could be used for ocular allergies.
So we might actually see biologics specifically for allergic conjunctivitis in the near future.
It's possible, and it would be a huge deal.
It would, especially for patients who don't respond to the usual treatments.
Right, or who have really bad symptoms.
What else is on the horizon?
Well, another area of research is allergen immunotherapy, also known as allergy shots.
Oh, yeah, allergy shots.
It involves giving the body small doses of allergens over time to basically desensitize the immune system.
So it's like training the body to not react to the allergens.
Exactly. And while it's mostly been used for respiratory allergies, there's growing interest in using it for eye allergies, too.
So could allergy shots one day be used to treat allergic conjunctivitis?
We're hoping so. There's also research on sublingual immunotherapy, which is basically allergen drops or tablets that you put under your tongue.
That sounds much easier than shots.
It is. It could make allergen immunotherapy more accessible for patients.
Right, especially those who don't like needles.
Exactly.
It's incredible to see all these advancements.
It is. It feels like we're entering a new era of ocular allergy management.
It does. But with so much research coming out,
Yeah.
it's hard to stay up to date.
You're right. Staying informed is so important,
It is.
especially in a field that's changing as quickly as this one.
What are some good ways to keep up with everything?
Well, going to conferences is always good. Reading scientific journals,
Right.
following reliable sources online.
Makes sense. And of course, listening to the podcast like the Deep Dive can help.
Absolutely. We try to make the research accessible and interesting.
You do a great job.
Thanks.
Well, I think it's time to wrap up our deep dive into the latest in ocular allergy research.
It's been great exploring all this with you and our listeners.
It really has.
Yeah.
To our listeners, we hope you found this deep dive helpful and interesting.
Yeah.
Remember, knowledge is power.
It is.
And staying informed about the latest research can help us and our patients
Absolutely.
get the best possible outcomes.
Well said. Until next time, keep those minds curious and those eyes healthy.